Yeah, I'm Dr. Sharath Reddy, Interventional Cardiologist, Medicover Hospitals, Hyderabad. So we have been witnessing increased incidence of heart strokes at young age. I think there were a couple of incidents happened recently, and probably in 2 months before, one politician and one cinema hero also died of acute heart stroke at very young age. The incident happened when people were doing gym activities in their day activity. So the popular myth here is the gym or physical activity inducing heart stroke. So that it's a myth. So that is not the truth. See, generally, any physical activity will give a prevention for development of heart diseases, and also it reduces incidence of heart strokes in future. But that is a long-term benefit which we get with physical activity. But when somebody is starting a physical activity, right, so at 25 or 30 or 35 years of age, if somebody is starting a physical activity, if they have any symptoms or if they have any family history of heart diseases, it is always recommended before they initiate physical activity or gym activity, they have to undergo a complete cardiac evaluation so that we can understand how much exercise they can withstand, how much they have to do, and based on that scientifically we can recommend what they are supposed to do. So this is one thing which is very, very important, and most of the people are neglecting. So, and when someone has already some sort of heart blood vessel blockages and they are starting gym activities or any other athletic activity without being tested for that, then that is the time when they land up in trouble. So physical activity basically induces heart stroke in vulnerable individuals. So somebody who already had a blockage and is initiating a physical activity can end up in a problem. So it is a vulnerable individuals can develop this problem. So we shouldn't blame this gym or physical activities inducing the heart stroke. No, they are basically precipitating heart stroke in a vulnerable person. But all the studies which have been done in patients with heart disease, physical activity was associated with reduced incidence of further strokes, and it is definitely recommended as a primary as well as secondary prevention for all the patients. Okay, and coming back to this stroke in young, why young people are landing in heart stroke? So the commonest reasons which we found in heart stroke in young are, so one is strong family history of heart disease, premature heart disease. If one of the family member, if it is male, less than 55 years, and if it is female, less than 65 years, if they developed any heart stroke, the chance of heart stroke to the children in that family is slightly high. So this is a strong family history of heart disease is one thing. Next is habits like smoking or drug abuse. I mean, these are the two things which are rampant in these days, and these two also induces early heart strokes. And next is lack of physical activity plus increased stress due to professions. So these are the three main reasons why people are landing up in early heart strokes. So, and by handling these things, like handling by doing regular physical activity, by handling our mental stress, by adapting some sort of meditation techniques, and we can't change our genetic profile, but by having early checkup around 35 years of age, so we can identify all metabolic reasons and we can treat those metabolic reasons so that their chance of heart attack will come down. And also, cessation of habits like smoking and drug abuse. So these are very important. So by making these changes, probably young people can reduce their chance of heart stroke in future.